Well, this is National Family Caregivers Month, and much like a busy holiday season, being a caregiver can be rewarding, but it can also be emotionally and physically demanding. That's why Kaiser Permanente is stepping up to help fight a recent rise in caregiver burnout. And this morning, we welcome Kaiser Permanente neuropsychiatrist, Dr. Michelle Medina. Dr. Medina, thanks for being here.
Thank you for having me.
Of course. This is a big deal. We're seeing a lot of this. We had a statistic earlier before we went to break that I think it was 1 in 5 adults are now caregivers. What do you feel like causes the stress in caregivers?
Yeah, no, absolutely. And it, being a caregiver is probably one of the most important and at the same time most demanding roles that somebody could embark on. And caregivers have a tendency to sacrifice their own self-care, their own needs, in an effort to take the best care possible for their loved ones. And it's this accumulation of stress, that leads to what we define as caregiver burnout, which is a state of physical, emotional, and mental exhaustion.
What do you think contributes to it, especially during the holidays?
Well, during the holidays, there's just so much going on. There's family events, gatherings, meetings and traveling, shopping, right? And you're trying to pack all this together into already jam-packed schedule. It's a recipe for more stress and possible burnout.
How does a caregiver or even a family member of a caregiver recognize that burnout is happening?
Yeah, so that's I think the most challenging part is that the caregivers themselves know all the signs and symptoms. They know stress, anxiety, depression, mood changes, insomnia, because they are able to recognize that in their loved one, right? Sometimes they can notice the most subtle changes in these changes, but there's a disconnect when it comes to noticing it in themselves. And I think that's where we just need to work on is, that those same symptoms that they're able to recognize in their loved one, they need to also recognize it in themselves.
That's so difficult, right, when you're caregiving for someone, because you're doing that because of the type of person that you are, so you often don't think about yourself. But what are some ways to really address it when you do have that moment of pause to recognize that it's happening?
Yeah, so the same what they would do for the loved one is what they need to do for themselves, right? Which is, to reach out, ask for help, right? Seek help, and make sure that you're also prioritizing yourself to be able to care for your loved one.
What is it and advice that you would give to folks, especially as we're heading toward Thanksgiving and then Christmas and then New Year's? What would you say, and what are you saying to your patients?
Yeah, so the holidays will bring some added stress, but it's also an opportunity, right, to implement these tips that we recommend. So there's a few other highlights. So I think the first one is that to stop neglecting your own self-care, right, and that it's okay to put yourself first once in a while. Second one is to ask for help, and that asking for help is not a sign of weakness. Third is to say no, right? If there's a commitment you're being asked to participate in that's not meaningful for you or your loved one, then just say no. The fourth one is to connect with support, right? So support could be in with friends or family, but church, it could be support groups, classes, right? And and there's all these resources available, but none of them are going to reach you, unless you reach out. And I guess the fifth one, the last one I'd say, is that to remember tips 1 through 4, right? And then since the holidays are coming up, I'd say that one thing you could view this as is that give yourself the gift of implementing these 4 tips, and then I think you'll see that the gift is not just for you, but for your loved one as well, because both of you are going to be in a better place.
Yeah, I love that. And I always tell friends, like, you can't help anyone else if you're not okay. If you're not good, it's hard to help others. Dr. Medina, thank you for being here. I know you mentioned some of these, but we have put some practical self-care strategies. We want to put those on your screen here. Again, as you just heard, setting boundaries, learning to say no, which I know can be difficult, but you have to do it. Don't be afraid to ask for help when you need it. Your physical health is important as well, so eat well, exercise, get sleep. Consider also, as Dr. Medina said, joining a support group. Know that you are not alone. There is a QR code that's on your screen for Kaiser's online resources. Check that out whenever you can, and just remember all of those tips.